person should contact an allergist, asthma specialist, or immunologist, which is part of our specialty, whenever they have symptoms that they suspect might be due to an allergy. Allergies are very unpredictable, and they can come and go. And so it's really more about the patient's feeling about what's going on with their body. Well, the most common cases are asthma, allergies, immunology, but also I definitely see a lot of skin conditions. There's a lot of overlap between my specialty and other specialties, such as dermatology, but also pulmonology, ear, nose, and throat, because there's a lot of sinus problems with people that have allergies. And so, I see a wide variety of conditions, which makes my specialty very enjoyable. In addition to the ones that I mentioned, definitely seasonal allergies, like year-round perennial allergies also, drug allergies definitely, food allergies definitely. Put allergy in the computer and you'll find everything. I'm a detective. When I see somebody for the first time, of course they fill out an intake form, which helps to guide me in terms of how to help them. And so if they write down, many times what I see on the paper is one thing: cat allergy. And so I know right away we're talking about an environmental exposure and something that we need to talk about. Where's the cat? Who's got the cat? Did you fall in love with somebody that has a cat? That kind of thing. But they sometimes they put something completely different. So that's the process, is that they put down what they wanted to discuss. And then we, meet and discuss what it is. We start with a conversation, and sometimes the conversation can evolve into a deeper conversation about other allergies, because these are all related to each other. And sometimes they're actually having some asthma. I mentioned cat allergy, but they may be not only sneezing, but wheezing. And so we start talking about other diseases as well. And so then we make a plan. Of course, there's a physical exam is minimal, but the plan is the most important part. So testing is variable. I definitely do skin testing. I also can order blood testing if the patient prefers, but and there's slight differences between the two types of tests, and we always talk about that. But as far as testing, there are other types of allergy testing, not just scratch testing. There's also what's called a patch testing. That's for a different type of allergy called contact dermatitis, which is a delayed type allergy. It's a different type of allergy. But I do perform that as well. And there's also immunology testing, which is a blood test that I sometimes order for people that are having a lot of infections. So the testing really is dependent on the interview. In my practice, I offer several ways of getting immunotherapy. And when you talk about allergy immunotherapy, it's not the same as like immunotherapy for cancer or even for autoimmune diseases like lupus or rheumatoid arthritis. It's a different type. It is traditionally in America, again, it is allergy shots, which it's a long-term treatment, but it can cure allergies. And so that is traditional, but I also offer sublingual or allergy drops, which is a little bit easier for patients because they can do it on their own at home. It also can potentially cure the allergies. So yeah, I definitely offer all the options to every patient that has allergies. I know it's a part of the discussion. Because it's a long-term treatment, I usually prefer the patient to choose because they have to be committed for it to work. If they just do it for a couple of months, it's not going to help. It's just a waste of their time and waste of their money. And so I want them to think about it, research it, and then when they're ready, we're ready too. I don't think the first step for somebody that thinks they have allergies is necessarily to call a specialist. Certainly, there are plenty of really good medications that are over the counter for allergies, and you can go right to Walgreens or CVS or any pharmacy and pick those up and try them. And they're safe and they are effective. So that would be the first step, especially for someone with like nasal sinus allergies. Now, if you have suspected asthma, that's a little different. I would say the first step is to call your primary care doctor if you have one. If not, you can always call an allergist, and that's our wheelhouse. So those are the steps I would take. Certainly, anybody that's having asthma symptoms where they feel tightness in their chest or shortness of breath, wheezing, they're going to be feeling very afraid. They're going to want help. And so I'm here to help.